Hello.
Come in.
Hi there. How are you doing today?
I'm doing good.
Excellent. Well, my name is Frank. I'm one of the student nurses here, and I was asked to come in and do a physical yearly exam today. Okay. First of all, I'm going to provide for patient privacy. Secondly, I'm going to sanitize my hands, do hand hygiene. Next, I'm going to check the ID band on the patient. Can you please give me your name and your date of birth, please?
Denali Grubb, 6/15/94.
Okay, and are you allergic to anything?
No.
Okay, perfect. That matches with the EMR on electronic medical records. Let's see here. So I'm going to assess the environment. Everything looks safe here as well. I just have a question for you. What brings you in today?
Just my yearly medical exam.
Oh, perfect. Okay. So in that exam, I'm going to do a few things, just to let you know what this exam is going to look like. First, we're going to just ask you a few questions. Secondly, we're going to take some vital signs. I'm going to do a head. I'm going to check your skin on your chest, your back, your arms, your legs, and we're going to check your head, eyes, ears, nose, and throat, and also check those lymph nodes as well. Afterwards, we're going to do a heart check, which is called a cardiovascular check. We're going to do respiratory, make sure your lungs are working right. We're going to listen to your abdomen as well and check your abdomen and make sure everything is working well there too. Okay. After that, there's going to be a neurological examination to check your 12 cranial nerves, make sure things are working in order there, and then afterwards we're going to do a muscular skeletal examination, just checking muscle strength and balance, and making sure the joints and all your muscles and bones are working properly. Does that sound great today?
Yes.
Perfect. Okay, so first we'll start off with some questions. Have you had any hospitalizations recently?
Mm-hmm.
Have you gone into surgery for anything?
No.
Okay. Are you on any prescription medications?
No.
No. Do you take any over-the-counter medications?
No.
Any herbal supplements at all?
No.
No. Okay. Would you say that you feel like safe in your environment, like at your house?
Yeah.
Perfect. Do you have any history of alcohol use or drug use, or do you smoke cigarettes or smoke anything vape?
No.
No. Oh, okay. Perfect. All right. So next we'll do a general survey. Patient appears happy and posture's great, speech is clear. Where are we today?
Westella, Alaska.
Perfect. What's your name?
Denali Grubbs.
Do you know the date today?
December 9th.
Sure. And then the time?
Like 3:30.
Sure. Okay. So it looks like the patient is alert and oriented ×4. His speech is clear as well. Looks like her personal hygiene is great. She takes care of herself. Personal hygiene is great. Next thing I will note is to do the vital signs. So I'm going to do some vital signs. So first I'm going to need to take your temperature. So if you can put this underneath your mouth, that'd be great. And just hold it there till it beeps. While that is going on, I am going to need to take a pulse as well. You can give me your arms there, that'd be great. temperature is at 98.5 degrees Fahrenheit. Pulse left radial arm is 62. Strong pulse, and respiratory rate was 20. Both equal rise bilaterally, and no advantageous sounds in her lungs. Next, we'll need to check your pain level on a scale of 0 to 10, 10 being the worst pain you've ever had in your life and 0 being no pain at all. What would you rate your pain today?
0.
No pain today. Perfect. And I'm going to put on this O2 sensor onto your finger real quick to check the oxygen level in your blood. It looks like it's registered at a 98 SpO2. Perfect. I'll note that. Next thing we'll need to do is take your blood pressure. So
Okay.
I'm going to do a 2-step blood pressure test for this. Do you have an arm preference of where you would like this to go?
No.
Okay. Is it okay if we use your left arm?
Yeah.
Okay, perfect. If you put your arm out just like this, that'd be great. Okay, put that right there. Okay, now we're going to do this first. I'm going to find the brachial artery, find the pulse. Okay, I'm going to pump it up till it leaves. That is going to be a 110 over palpation, and I'm going to wait 30 seconds or so to redo the blood pressure to get my systolic and diastolic readings. Okay, so after that, we are going to check your skin, and I'll come back and finish that blood pressure. I need to check, I'm going to look at your skin. I'm going to ask you if you note any tenderness, but first I'm going to inspect your skin, and then I'm going to begin to palpate certain areas, and you just let me know if you feel any like pain or tenderness in those areas. Does that sound good?
Mm-hmm.
Perfect. Okay, note that her skin on her head looks nice and pink and perfect. The skin on her neck, there's no deformities or any lesions or bruising. The skin on her arms, you can lift your arms and rotate them around. There's no cuts, no lesions, no contusions. Her other arm as well, no cuts, no lesions, no contusions. Can you spread your fingers? You can see in there. Perfect. I'm going to check her chest. Looks like there's no cuts, lesions, bruises, contusions, or deformities. And if you can lean forward for me, please. I'm going to check the patient's back. Okay, no deformities. Skin looks intact. Temperature is within normal range. Okay, and if I can see your legs as well, if you can lift them up. Perfect. Okay. The legs look great, and so do the feet. I don't see any deformities in the skin. The color looks normal, no cuts, no bruising, no deformities, no lesions. Excellent. Since it's been about 30 seconds, I'm going to go back and do your normal blood pressure. Is that okay?
Yeah.
Perfect. So 112/62 is the blood pressure reading. I'm gonna take this off here. Perfect. Alright, next I'll need to do some light palpation on your arm. So if I can grab your left arm. Okay, any tenderness
No.
throughout your arm? No?
No.
Okay, any tenderness here throughout your arm?
No.
Okay, and on your skin, on your face?
No.
Good. And on your neck? Oh, good. And on
It's
your,
good.
okay, and on your legs?
It's good.
Okay. And your feet?
It feels good.
Good. Okay, can you lean forward? And on your back? Any tenderness?
No.
No? Okay, perfect. Awesome. So, next, if I could see the back of your hand here, I'm going to just pinch you real quick,
Okay.
just to check the skin turgor. Looks like there's no tintin on the skin. It means that she is nice and hydrated. Awesome. Okay, next thing I'll need to do is we're going to do our head, eyes, ears, nose, and throat examination, okay?
Okay.
Okay, so as I'm inspecting the head, I notice the skull, it's symmetric, within the right proportion to the body. Her scalp, looking at the scalp, it looks like there is no infestations, really healthy hair. I'm going to check your eyes, so if you can just look at me here. So there's no, I'm going to shine a light in here, okay? Looks like there is no orbital edema, eyelashes are on point. There's no ectropion or intropion. There's no styes. Looks like the cornea is nice and clear and full of light. Perfect. Okay. Next is I'm going to go to your ears. If I can see both those ears on that side. Okay. And upon me touching them, does it hurt at all? No?
No.
Okay. Upon palpation, there's no tenderness in the ear.
No.
Okay, and as I look into the ear, I don't see any drainage on each side. It looks symmetric for her head. Now I'm going to look at your nose. Is it okay if I touch your nose?
Yes.
Perfect, okay. And as I'm palpating it, does that hurt at all?
No.
Is there any tenderness?
No.
Okay, so I don't see any deviation on her nose. Looks like on the inside there, there's no swelling. Let's see here. Now, mouth. We're going to look at your mouth. Looks like the lips are nice and healthy. No chapping or any lesions or contusions or scarring. If you're willing, you can open up your mouth wide and just say ah.
Ah.
Perfect. Thank you. Next.
Ah.
Okay, that's good there. I'm just checking the oral mucosa. Looks like it's nice and pink and moist with no drainage, no cuts or lesions. I'm going to look at the gum line. The gum line looks healthy all around, top and bottom. I'm looking at her teeth. I don't see any evidence of any caries or cavities. Let's see here. Next thing, if you can open up very wide again, I need to see
Okay.
the back of your throat, called
Okay.
the oropharynx.
Okay.
Okay. Ready? Okay. Perfect. Okay, I don't see any purulent drainage. Everything looks soft, pink, and moist. I see those tonsils back there, and I grade them at a 1. Perfect. All right. Next, I'm going to have to check those lymph nodes. So I'm going to have to come up, and I'm going to have to palpate around the back of your head, and in your neck, and in your chin. Is that okay?
Yes.
Okay. So we're just checking to see if there's any swelling in these areas. If there's swelling, that could be an indication of an infection somewhere in your body. So it's the areas store the white blood cells, and it's a really significant place for drainage of the blood and lymph in your body. Okay?
Okay.
All right, first I'm going to check the occipital lymph node. So I'm going to come back here, I'm going to palpate. I don't notice any swelling, no tenderness.
No.
Perfect. After I check the occipital, I'm going to check the post-auricular, which is behind your ears. No swelling or tenderness.
No.
Okay, in the pre-auricular lymph nodes, any swollenness or tenderness?
No.
No. Okay. Now the tonsillar for the tonsils. I'm going to palpate the tonsils. Any swelling or tenderness there? Okay. Next, I'm going to need to check the submandibular. Any tenderness?
No.
Okay. And then the submental here. Any tenderness?
No.
Okay. Now we're going to need to do the pre and then the post cervical. Any swelling or tenderness here?
No.
Okay, and then now lastly, we're going to check the supraclavicle. Any tenderness as I'm palpating there?
No.
Okay, no swollen. All lymph nodes there look nice and clear. Next, we will continue with the cardiovascular assessment.
Okay.
Okay, next we're going to do the cardiovascular assessment. So with that, I'm going to use the stethoscope, and I'm going to listen to a few points on your chest wall to listen to the different parts of your heart working. That's going to give us a little bit of insight on how your heart's doing. Does that sound good?
Yeah, sounds great.
Perfect. And then afterwards, I'm going to do a couple different other tests to check how blood is moving through the different areas of your arms and legs. Okay. Perfect. So I'm going to first put my stethoscope on. Next, I am going to auscultate and listen to a aortic valve. So I'm going to use the mnemonic ape to man aortic valve, and here I am listening for the S2 sound, which is most normally heard here. Next, I am going to listen to the pulmonic, and I am on skin. I'm also can hear the S2 sound. Okay, next I'm gonna have to lift up here and go under. Is that okay?
Mm-hmm.
Okay. I'm at the herbs point on the skin. And then I need to go to the tricuspid, which I can hear the S1 sound, and the mitral valve. Perfect. So everything sounds great. I don't hear any bruits or any thing wrong with any of those heart sounds. Next, if you can put your arms out here like this, I'm going to pinch here real quick. And look, looks like the capillary refill is within normal limits. There is excellent perfusion to her upper extremities. And if you can kick out your feet there for me. Okay, and then I am going to check here on your feet. Excellent. So it looks like you have excellent perfusion down into your lower extremities as well. Next, I'm going to check your lower extremity for edema, any swelling or pitting edema. So I'm just going to have to press in here on your lower extremity. Is that okay?
Mm-hmm.
Okay, press in, release. There is no pitting edema, so grade 0 on that. Next, I'm going to need to check your dorsalis pedis pulse to see the strength of how your heart is working. So if you can lift up your foot for me, please. And I'm going to check her dorsalis pedis pulse. Looks like it is a +1 strong, not thready pulse at 62 beats per minute. Awesome. So after the cardiovascular assessment, now I'm going to do a respiratory assessment. I'm just going to be checking for different types of breath sounds as you're breathing in and breathing out. I'm going to need to do some on your back first. You can lean forward. I am going to be on the skin on her back, and then there are 5 positions on each side of the back here on the posterior side. So I'm going to do for number 1 here, breathe in. Now over to the other side, in and out. Okay, in. And out. Okay, number 2 on this side, in and out. Okay, I'm going to lift this up. Is that okay?
Yeah, that's good.
Okay, now I'm going to do number 3. Go ahead and breathe in and out. Okay, number 3 here, in, out. Okay, 4, in, out. In, out, and 5, in, out. And one more time for the 5th on the back. Perfect. Okay, now I'm going to need to do the front. So on the front there are going to be 4 points on each side. I'm going to also take with my diaphragm to listen to any advantageous breath sounds. So we're going to start at the apex of the lung on this side. Go ahead and take a deep breath in. Okay, over to the other side. Okay, go ahead and breathe in and out. And then in and out. Okay, and if I can come up under, if you lean back just a little bit so I can get up under your skin. Okay, go ahead and breathe in. This is the 3rd point on the front, and then over here, go ahead, breathe in, and then 4th, in, out, and then in, and out. Perfect. Now if you can sit up for me, please, I'm going to need to get the lateral sides, and there's 4 positions on each side that I need to listen to. I'm going to come up underneath your shirt here, and okay, if you can breathe in, and then out. Okay, in, out, in. How you doing?
Good.
Okay, in. Alrighty, and then now on this side, we have to go up and under and get on the skin. Okay, breathe in, okay, and then one more time. All right, thank you for participating there. So that were all the points on the posterior, anterior, and lateral aspects of the thorax. It looks like there were no advantageous breath noises, no wheezing, no rhonchi, no crackles, and no stridor. as well. Okay, next I'm going to check your abdomen. So if we can lean you back in this
Okay.
awesome bed that our hospital has.
Okay.
If we can pull up your shirt here so I can inspect. Okay, abdomen looks great. There are no lesions or contusions on all 4 quadrants. Skin color is normal for race. And everything looks excellent. Okay, next I'm going to need to take a listen on all 4 quadrants. Is that okay?
Yeah.
Okay. Okay. Okay, right lower quadrant, signs are normal active. I didn't hear any abnormal sounds. Okay, right upper quadrant. Okay, right upper quadrant, sounds are normal, active, no advantageous sounds. Now we're doing left upper quadrant. Left upper quadrant, normal active bowel sounds, no advantageous noises. And now we're doing the lower left quadrant. Right lower quadrant, normal active bowel sounds. Okay, and then next I'm just going to need to press down on each quadrant here real quick. Note any tenderness there?
No.
Any tenderness up here?
No.
Okay, left upper quadrant, any tenderness?
No.
And lower quadrant, any tenderness there?
No.
Perfect. So I didn't notice any abdominal pulsations either. Next, we will move on to our neurological examination. Sound great?
Yeah.
Perfect. Okay, now we're going to do the neurological examination, okay?
Okay.
Okay, so for cranial nerve 1 and for cranial nerve 2, those are going to be deferred. For cranial nerves 3, 4, and 6, we are going to look with this pen light and do perla, okay? If you're willing to move closer to me here and have both eyes open, I'm going to shine this light in to your left eye. Ready?
Yes.
Okay. Okay. And then now on your right eye. Okay. And then now follow it towards your eye. So pupils are equal, they are round, they are reactive to light, and they are accommodating well. Okay, so the next thing I need to do is to test your muscles in your eyes. So if you're going to follow this pen light with your eyes, okay? Okay, so there's no nystagmus noted in her eyes. Okay, so next I'm going to check cranial nerve 5. For that, I'm going to need to put this on your face and just tell me where you feel it, okay?
Okay.
Okay.
Forehead.
Alrighty, you close your eyes. Okay.
Cheek.
Right cheek,
Right cheek.
left cheek, okay.
Left cheek. Chin. Nose. Forehead.
Okay, perfect. And so if you can, I'm gonna put my hands by the back of your jawline. You're gonna clench your jaw. Sound good? Okay. Okay, clench your jaw. Okay, that looks really good. Okay, next we're gonna do cranial nerve 7, and cranial nerve 7. Just follow me with that. We're gonna close our eyes really tight. We're gonna open them, raise our eyebrows. Okay, smile, frown, puff your cheeks out. Okay, perfect. So that's cranial nerve 7. Now we're going to do cranial nerve 8. So I am going to next, if you can close your eyes, I'm going to be rubbing by your ears and tell me, do you hear?
I can hear it.
Can you hear it in each ear?
Yes.
Okay, perfect. Cranial nerve 8 is intact. We are going to check now cranial nerve 9. So if you can take this water and swallow it. Okay, notice that she can swallow. Now open your mouth wide and go ah.
Ah.
Okay, patient can phonate the word ah really well. That's cranial nerve 10. Now we're going to do cranial nerve 11. So for that, to test that, I'm going to need to put my hand on each of your shoulders and you try to shrug as hard as you can against the resistance that I'm pushing down on, okay?
Okay.
Ready, go. Okay, perfect. And then next, I'm going to put my hand on one side of your face and then you're going to try turn your head against the resistance.
Okay.
Okay? Okay, now we're going to do the other side. Okay, perfect. All right, cranial nerve 11 is intact. Cranial nerve 12 is a fun one. I just want you to stick your tongue out at me. Okay, now move up, down, and side to side. Perfect. Okay, so cranial nerve 12 is in alignment. Next, I'm going to need to test your patellar tendon on your leg. So if you can just let your leg just droop over just like that. And I'm going to now I have a reflex hammer here. I'm going to hit her patellar tendon. Okay, go ahead and lift up on the other side as well. Okay, patellar tendons are strong and reactive. Next, I'm going to need for you to do a test here where we do finger to nose. So just copy me, just go like this. Perfect. And then next, if you could put your hands out like this. You can go like this as fast as you can. Awesome. Perfect. Next, I'm going to have you do the Romberg test. So the Romberg test is going to test your balance and your cerebellum. So if you stand up, just right where you are, with your feet parallel apart, we are going to stand. Put your feet together. And now for 30 seconds with your eyes open, I'm just going to see if you're moving beyond a normal sway. Okay, now if you close your eyes. Okay, perfect. Romberg test is negative. There's minimal swaying and everything looks normal. And the last thing I need to check is your gait. So this is the way that you walk to see if everything's normal there, if there's any limps or anything like that. So if you can just walk over to the middle of the carpet and then just walk right back. Perfect. So there's normal gait. Everything seems in full working condition and order. With all 12 of your cranial nerves and your patellar reflexes and your cerebellum is working great, it looks like. And that wraps it up for the neurological examination.
Thank you so much.
Yep. Okay, so the next examination that we need to do is we need to do our musculoskeletal examination. So if I can have you stand up, please. So we are going to first do our cervical range of motion. So I'm just going to ask you to copy me. Okay, so we're going to bend our head forward to our chest. Now we're going to move our head all the way back. And then look straight forward. And then now we're going to bend our neck laterally to the left. And then to the right. Okay.
My left?
Yeah.
Like this?
Yeah, that's perfectly fine as long as we've gone to each side. Okay, and then we're going to do just try turn your head back and forth as far as you can go. Okay. Okay, perfect. Okay, so next we're going to do upper extremity. So if you can just copy me. Okay, first we're going to flap like a bird. Awesome. Okay, next thing I need you to do is we need to do internal and external rotation. So we need to turn our arms in and out like this. Okay, perfect. Next we need to just put our arms up like this. Okay, and then all the way back as far as you can go. Excellent. Okay, so next I'm going to have you sit down, please. And I'm going to look at your elbows. So if you can just bend your elbows like this, like you're lifting some weights. Okay, go ahead and lift up. Now bend it back as far as you can go. Excellent. Okay, so the next thing I would like to do is I would like to look at your wrists. So now, just like we were going to lift weights, we're going to have to bend your wrists in like this. Okay, and then we're going to try bend it all the way back, just like that. Okay, the next thing I need to do is we're going to check our fingers. So what we need to do is for you to spread them as far out as you can, bring them together, far out, together. Okay, now we're going to grip, open. Okay, now open, go like this, perfect. Everything looks good there. The next thing we need to do is a thumb opposition. So we're gonna have to put our hands out just like this. And then I'm going to have you touch your thumb to your pointer finger, middle finger, ring finger, and pointer finger. Excellent. All right, so next I'm going to have you stand up because we're going to do your lower extremity. But before that, I'm going to have to grab your hands there, and if you can grip my fingers as hard as you can. There we go. Grip strength and tricep strength and bicep strength. Okay. So next, if we have you stand up, please. So grip strength is a 5. Next, pretend you're lifting weights again. Okay, and I'm going to put some resistance here. Okay. Now on your left side, I'm gonna, okay, great. And now push down. Okay, now push down. Okay, biceps and triceps are at a +5 strength. Okay, next I'm going to do lower extremities, and we're going to do our hips. So the first thing we need to do, the same thing like our arms, we're going to do internal and external rotation. So with your left leg, just rotate it in and out. Perfect. Okay, and then now do it with the other side, left, in and out, in and out. Okay, so now we're going to kick forward with one foot at a time. Okay, and the next foot, forward. Okay, and then now if you move forward, you're gonna have to kick back a little bit with each foot at a time. Okay. Okay, perfect. Okay, so the next thing, if you can sit down once again, we are going to do your knee. So if you could just bend your knee in, okay, and then out, okay, and then other knee in and then out. Excellent. And then so now for your ankles, we are going to come over here, and we're going to turn them in like this, like one foot in like that. Okay, and one foot out like this. Okay, and same on the other side, in and out. Okay. Next thing, I'm going to, if you can turn around, I'm going to look at the curvature of your spine. So there's no lordosis, there's no kyphosis or scoliosis. Perfect. So if you can sit back down, that does it for the examination. Thank you very much. We'll get all this information down on your yearly exam, and your provider will be in shortly.
Okay, thank you.
Yeah, thank you.